I talked to a psychiatrist and former law enforcement officer about what the process is when someone is experiencing a mental health crisis and is taken to the hospital under an emergency custody order, and why they might end up in jail. When Henrico Police responded to a home on Fordson Road at 11:34 a.m. on March 3rd for a possible burglary call, they identified Irvo Otieno as a potential suspect. A spokesperson for the police department said officers used their crisis intervention training and identified that the person was experiencing a mental health crisis. So they issued an emergency custody order and transported him to the crisis receiving center at Henrico Doctors Hospital. Once there, Otieno would have been met by the hospital's psych team and medical team, according to Dr. Martin Buxton, the former chief of psychiatry at Chippenham and Johnston Willis hospitals.
Somebody would try to calm him, talk him down.
Buxton, who is unconnected to this case, says that if that didn't work and the individual was combative, the staff would have restrained them.
But if somebody was violent and you could not slow them down and they were tearing up your emergency room, you would restrain them and try to medicate them.
In the case of Otieno, Henrico Police say he became physically assaultive toward officers at the hospital, so they arrested him and transported him to the Henrico County Jail, where he was charged with assault on a law enforcement officer, disorderly conduct in a hospital, and vandalism. Would you expect in a situation like what I've described that the staff would have at least tried to put a drug in them that ultimately would have calmed them?
No question.
We don't know if the hospital staff did or did not give or attempt to give a calming medication. Mark Bong, who used to work in law enforcement and is currently an attorney in Henrico who often represents police officers, says he wonders why the officers decided the best course of action was to take Otieno to the jail.
Someone who is in a hospital setting who then gets placed in a jail setting is probably getting insufficient treatment, especially on the weekend. The availability of medication and treatment are going to be greatly reduced in a jail environment than they would be in a hospital environment.
Jails are clearly not the optimal place for a psychiatric patient. They could be re-traumatized, they could be stirred up, the noise, the lack of capacity to sleep. All those things go against mental health.
Buxton says it's possible there were no psych beds available at Henrico Doctors or other hospitals.
Was there a bed at Forest? If not, were they trying to get another bed in town and they couldn't find one because Central State used to be the designated backup, and whether Central State had a bed. They may have decided they couldn't manage them there, or they didn't have a bed there, and there was no psychiatric bed available in town. I mean, that happens.
Lots of questions still. We have asked a variety of entities in Henrico County, including the police and mental health services, about what exactly happened in this situation, and we are still waiting to hear back.